Hello, my name is Damian Mingle. I'm the Chief Data Scientist with WPC Healthcare out of Nashville, Tennessee in the United States. We're very excited to be part of the 3rd International Global Public Health Conference in Sri Lanka. Today we're going to be speaking about applied data science and how to use that to be able to predict West Nile virus outbreaks. So the situation is that West Nile virus has spread to every continent except Antarctica, and it's the most widespread cause of orbiviral neurological disease in the world. The complication is that there really is no vaccine available to date, and there are limited treatment options. So the question really becomes, how can we then predict where outbreaks are likely to occur, and how can we stop indiscriminate aerial spraying? Our answer is we would like to use data science and the algorithms that it provides, specifically to help country offices and international partners more efficiently and effectively allocate the resources towards preventing transmission of this potentially deadly virus. With regard to the algorithm's effectiveness, currently it's able to predict 85% accuracy using area under the curve. So where we look at true positives, true negatives, false negatives, we're able to use a confusion matrix to be able to decide just how well the algorithm is actually doing. We've done this using sound methods, some of which are listed here. We've portioned the data using statistical standards to develop a training data set and also a testing data set. We've developed a more robust model because we've used the count of mosquitoes trapped based on location as a weighted average with other nearby locations. And we're confident in the predictions that are occurring plus or minus 3%. Here's a visualization comparing the two methods. On the left side you have the West Nile virus algorithm, which we've developed. It's got an accuracy of 85%. And then random spraying on the right side is a 50-50 chance of actually being accurate. Let me explain a little bit about the idea of random spraying. The idea there is that because up till now we don't know exactly where a mosquito is going to be that actually has West Nile virus or doesn't have West Nile virus, the idea is to kind of attack this in a very blanket style manner. We would just spray in general these certain areas, they would be on a schedule, and they would be very broad. It's the equivalent for the most part to chemotherapy and cancer in patients today. We don't exactly know where the cancer is per se, and we're going to attack everything, hopefully killing the thing that is a threat. And this is exactly the same thing. In the case of the West Nile virus algorithm, it's very targeted though. And so the benefits that it offers, it allows these international partners and country offices to limit the resources that go into carrying out the random spraying by being very focused and knowing with a high likelihood that they are attacking the West Nile virus present in mosquitoes. We accomplish this using machine learning, and machine learning is enacted so that we can understand the data characteristics that the mosquitoes are showing over time. And so what we've used are 13 variables. These 13 variables were given to us, and they represent the mosquito behavior in the area of Chicago, Illinois, in the United States. And they have been collected at strategic traps throughout the city. And they were already enacted in the sense that the city of Chicago was already performing surveillance on mosquitoes in the area. So it wasn't any new request, a new way to ask for the data. It was data that was already being collected. And we learned from the years 2008, 2010, 2012, and 2014, and there were over 10,000 rows of data. So it's not a very small data set where we might have to create synthetic data, and it wasn't a very large data set where we might have to use things like Hadoop clusters and some of these more esoteric technologies. We were able to accomplish this algorithm on a standard laptop, and we've been able to learn the mosquitoes both with and without West Nile virus. It's very important not to just simply learn about West Nile virus mosquitoes, but also the ones that don't have it as well, so that the algorithm can learn to distinguish between the two. Here's an example of another visualization. What you're seeing here on this top row is really the cases of mosquitoes where the virus is absent. And so on the bottom row, you see where West Nile virus is present. And this is with an X and Y axis of Latin long, and you are able to see across time. So this represents 2007, 2009, 2011, and 2013. This is a really good thing to use in practice. For us, it was great to be able to build intuition quickly about the sort of underlying problem that's present in this particular data science problem. So for us, the next steps, we like the idea of sharing data. We feel like being able to approach a pilot city to be able to test these sort of algorithms would be very beneficial to us in being able to learn more about the data underneath and learning about how to refine the algorithm, but also to public health as well, and being able to not only focus on areas in the United States, but also around the world. We would be interested in having more mosquito trap data from various regions around the world. We'd also like to be able to test more generally the algorithmic makeup of these procedures, the testing procedures, so that we can ensure robustness of the West Nile virus model. So lastly, we would point out too, our recommendation would be to develop a stability index for the West Nile virus. This is really important in practice when this is actually being rolled out. The idea there would be that even though we've assessed data at one point in time, we want to keep it general enough so that it applies to other situations. And there's really no way to tell that unless maybe you look at the distributions of how many mosquitoes are we predicting that have West Nile virus, or areas that have West Nile virus, and those that do not. Also looking at the distributions of the other variables that are provided to us in the mosquito trap data. Very, very important though, so that we can again prevent any concept drift, which is likely to occur when you're dealing with things in the natural order and also over time. If you're interested in reading more about West Nile virus, more in a contextual framework, Chancey's right up here in the Biomed Research International is very, very helpful. In addition to that, the West Nile virus fact sheet that's provided by the World Health Organization is also very, very, very helpful. One of the things that we would really like to extend to the international community is we are very open in sharing the algorithm that we came up with. We feel like it has a lot of promise, and we certainly want to give back in any way that we possibly can. So if you are an international partner or a country office, or you're part of a city or a state here in the United States, we would really appreciate you reaching out to us. We'd love to be able to discuss with you just kind of in a very open, transparent way how things were derived, how things came to be, and we're excited to be able to be a part of today's conference. Thank you.